I was treating one of the students that was complaining about plantar fasciitis. We did a bunch of things for plantar fasciitis with the balance method, with Tung, and it all improved a lot. But there was a last bit of pain in some movements when he put a lot of weight on his foot, and especially when he was forcing the foot, that wouldn't go away. And I decided, well, let's just add this. And all the pain went immediately away. So we can treat problems in the coccyx. We can treat hemorrhoids or anal prolapse. We can treat uterine prolapse. You can use it for seizures, especially in children. You can use it for trembling limbs. In general, for problems in the nervous system, because it has the shunjing of the brain. Plus, being a scalp point, we know that there's always an easier connection to the brain. Hi and welcome back to the channel. Today I'm bringing you one of the most versatile TCM points of all times. Yes, today we're going to be talking about an acupuncture point that's mostly part of TCM, although we can also find it in Master Zhong's acupuncture and versions of it in scalp acupuncture, which is one of the reasons why this point is so versatile and why it can be used in so many situations. This is already one of the points that I think is most widely used amongst many acupuncturists, or maybe all acupuncturists, but I think that it might still be even better than what you're thinking. And the point I'm talking about is Do My 20, or Governing Vessel 20, or Baihui. This is an amazing point, and today I want to do a deep analysis on it, and maybe we can figure out what makes this point so versatile and so valuable. And we're going to be looking at this point through the lens of TCM, through the lens of the balance method, of Master Zhong acupuncture, and of scalp acupuncture, namely Zhu Scalp Acupuncture. And first, let's start with TCM, which is what's probably most familiar to most of my viewers. And so this is Do My 20, or Baihui, that can be translated to 100 meetings. And this point, even if we just think about TCM, is already a very useful point. So it's a point that we know sits at the very top of the head. It's the meeting point of the 6 yang channels and the Dumai, and it's also a sea of marrow point. Along with this, we know that it's a point that can dispel wind, raise the yang, and calm the shen. So if we think about the classical indications for this point, and if we start thinking about, well, it calms the shen, so we can use it for insomnia, we can use it for psychosis, for mania, or just to relax the patient. It raises the yang, so it's a point that can treat coma, it can treat apoplexy, it can treat fainting. It's a point that dispels wind, so it's a point that, along with calming the mind, it can treat hemiplegia, some cases of aphasia. It's a point, being a sea of marrow point, it's a point that has a very strong action on the brain. Plus, being a scalp point, we know that there's always an easier connection to the brain. So even if we're just doing a TCM analysis of this point, you can see that it's an amazing point that can be used in most patients. This is a point that, even just for relaxation, I use on a lot of patients that I just feel are very stressed out. They are worried about the needles. They are they have some stress or anxiety because they came in late for the clinic or they got some traffic. Do My 20 is usually a very good point to help them relax. But let's go deeper and now think about the balance method. Well, we know that with the balance method we can use the Do My to treat itself or to treat the Run My. And using the image, and even without the balance method, if you just look at the classics, we know that the top can treat the bottom, right? So even by just thinking about pure balance method, if you think about the Do 20, the top treating the bottom, you'll see that this point will be very good to treat problems close to Do and Run 1. So we can treat problems in the coccyx. We can treat hemorrhoids or anal prolapse. We can treat uterine prolapse. Still looking at the balance method, and if you've studied the scalp system of the balance method, you know that the area of Zhu 20 will relate to more or less the height of the navel. So we can use this point to treat problems in the Renmai in the area of the navel, so some intestinal problems, and problems on the Dumai on the area of the navel, or at the height of the navel, so we can treat lumbar pain over the Dumai, of course, with 220. And now, looking at it through Master Tung's system, although 220 is not a Master Tung point, we have a point that's very close to 220, which is 1010.01, or Zhenghui, that can be translated to upright meetings. So this brings us close to the name of the Baihui, 100 meetings. And depending on the author, some authors will tell you that the location is the same as Du20. Some authors will tell you that it's 0.5 tsun posterior to Du20. So it's a very close point to Du20. And if we analyze 1010.01, we have the shunjing of the brain. So it tells us that it has a very strong action on the head and on the brain. And the general indications of this point are aphasia, the same as Du20, hemiplegia, Bell's palsy. You can use it for seizures, especially in children. You can use it for trembling limbs, fatigue, all type of disorders related to wind, again bringing us close to the classical indications of the point. Post-stroke, in general for problems in the nervous system, because it has the shunjing of the brain. There's a special indication for nosebleeds. It can also be used for headaches, although this is local acupuncture approach that I really am not a fan of. We can use it for vertigo and dizziness, and also for problems relating to speech. So again, a bunch of new actions along with some that will reinforce the ideas from TCM. And along with this, we also have a very interesting idea that comes from Zhu Scalp Acupuncture that has an area on the scalp that's called VPF. This is vertex perineum foot. And the area is square with 1 centimeter side that's placed around Dumai 20. So again, it will encompass our classical location of Du 20. And the idea of this point is that it can treat anything on the vertical line that goes from the top of your head down to the ground. So you can use this point to treat headaches. You can use this point to treat any problem with the spine because it's the midline going down. So you can use it, for instance, for spinal hernia. You can use the point to treat the coccyx. You can use it to treat the uterus. You can use it to treat hemorrhoids, of course. And you can even use it if you bring the line all the way to the ground to treat the foot. So this point is an amazing point to treat numbness on the foot, to treat the ankle, to treat plantar fasciitis. One of the reasons that's making me talk about this point is because during a practical session, during my last course in England, I was treating one of the students that was complaining about plantar fasciitis. We did a bunch of things for plantar fasciitis with the balance method, with Master Tung, and it all improved a lot. But there was a last bit of pain in some movements when he put a lot of weight on his foot, and especially when he was forcing the foot, that wouldn't go away. And I decided, well, let's just add this. And I added the Du 20, thinking about it as the VPF, and all the pain went immediately away, and all the students were very intrigued by it, and they were asking me, what's this, what's that? And I told them, it's just Du 20. What? Why would Du 20 treat the foot? And I explained all of these relationships to them, and they were amazed by it because, as probably happens to you, they were already using Dumai 20 for a lot of things, but they had no idea that they could use them for even more things, and that was so effective. If you have any patient with problems on the foot, try this point, and I guarantee you that you will see amazing results. This point will almost always work to treat symptoms in the foot. And this was a deep dive of Dumai 20. I know I'm usually more focused on Master Tung points, but there are also some points from other systems that are very interesting and very versatile. So if you want me to do more deep dives on TCM points or on scalp points, let me know in the comments, and I'll start doing more videos on it and not just focused on Master Tung, although The main focus of this channel will always be Master Tung and Balance Method Acupuncture because that's my main style of acupuncture, but I'm more than happy to do more deep dives on other points and that maybe I'm using for different applications that the ones you're used to. Thank you so much for watching. If you liked the video, don't forget to like and subscribe to the channel and share this video with anyone that might benefit from it, and I'll see you in the next one.